In our morning rounds, a potential high-tech lifesaver for stroke victims. A study found special mobile units cut treatment time for victims from 94 minutes to 56 minutes. The vehicles are rolling out across the country. Our Dr. Tara Narula is a cardiologist at Northwell Health and is here to explain how these stroke ambulances work. Tara, good morning.
Good morning, Alex. Every 40 seconds, someone in America will experience a stroke. These special ambulances allow doctors to start treatment before patients get to the hospital. And when millions of brain cells are lost every minute without treatment, saving time is crucial.
All of a sudden, I had a very bad headache.
When Monica Stanberry suddenly began to feel sick last Friday, her daughter called 911.
They were asking me to lift my legs and my arms and stuff. At first, my leg wasn't lifting anymore.
A special mobile stroke unit responded. It's equipped with a CT scanner,
Is there anybody with her that was at care at the time of the stroke?
a video conferencing system to communicate with doctors at the hospital, and drugs that can stop the most common type of stroke in its tracks. Remotely, a neurologist diagnosed a stroke and ordered life-saving medication. Dr. Muhammad Hussein managed her care at the Cleveland Clinic.
This actually allows us then to go right to a person's home, be able to make a definitive diagnosis of what type of stroke it is, and then that allows us to deliver the right type of treatment immediately.
The most common type of stroke occurs when a clot cuts off blood flow to the brain. Quick treatment with a drug called TPA can dissolve the blockage before brain cells die, preventing permanent damage or even death. Dr. Hussein's new study found that patients treated by a mobile stroke unit get TPA an average of 38 minutes faster than those transported in a regular ambulance.
It can make all the difference in the world between a person being able to walk or not being able to walk, for a person to be able to go home versus having to live in a nursing home.
Hey, y'all!
After 3 days in the hospiel, Monica still has a limp,
Thank
but the
you.
41-year-old nurse's aide feels lucky and grateful.
Hey, Doc.
Finally.
Oh, thank you.
Yeah.
Oh, I appreciate it.
About 20 of these mobile stroke units are now deployed around the country. Each ambulance costs up to $1 million, more than twice the cost of a regular ambulance, and about $1 million a year to operate. But consider this, the CDC says strokes cost an estimated $33 billion each year for rehab, treatments, and missed days of work.
Yeah, so absolutely worth it. So what's the time frame, essentially, that you need to get someone medication?
Time is critical, and these drugs, the window is about 4.5 hours from symptom onset to being able to use them. The golden hour, meaning the first hour after symptoms, is really the best time because you have the best chance at functional recovery and a better prognosis.
But what are the symptoms? How do you know when there's a stroke occurring?
So if you were to feel you couldn't feel one side of your body, you couldn't move one side of your body, you can't speak or understand language, you're having trouble seeing, you're off balance and can't walk, a quick acronym that other people can remember is FAST. Right. So you can ask somebody, can you smile for me? And if they can't move one side of their face, that would be concerning. Ask them to lift their arm up, and if they can't do that, that would be concerning. And then the S stands for speech. So ask them to repeat the sky is blue, and if they don't understand you or they can't repeat the sentence, then the T is time to call 911.
Okay, time is of the essence when that happens.
Yes.
Tara, thanks.